Hello, I'm Dr. Sindhu, one of treating doctor here today in the surgery. May I confirm your good name and age, please? Nice to meet you, Seema. May I know what brings you here today? Okay. Oh, I'm really sorry to hear about it, Seema. And I totally understand how stressful the situation is for you. Is there anything else you would like to add? Okay, Mrs. Samina, and before we start managing your symptoms, okay, I will ask you a few questions related to your condition, and some of questions will be, of personal and private nature. But let me reassure you that our conversation will remain confidential, okay, between you and me. Is it okay with you? And so, Mrs. Seema, may I know the status of your menstruation? Okay. When did you have your last period? And can you tell me when did you have your first period? At what age? At 14 years. Okay. Okay. Were they regular before they stopped? Okay. Okay, Mrs. Seema. Is there any past medical history? Do you have any hypertension, high blood sugars, any neck gland problem? Do you know your hemoglobin level? Okay. Okay. Okay, Seema, I'll ask you a few more questions. Okay. Do you smoke? Do you drink? How's everything at home? Okay. What do you do for a living? You're a teacher. Okay. So how's things at school? Okay. Okay, Ms. Seema, is there any family history of early menopause running in your family? Your mother also had early menopause. Okay. Okay, Ms. Seema, if you are taking any medicine prescribed by doctor or over the counter or any blood thinning or any calcium channel blocker? Okay. Okay, Mrs. Seema. So, can you tell me how this condition has affected your life? Oh, I'm really sorry to hear about it. So, Ms. Seema, what worries you most in particular? Okay. Oh, I'm really sorry, and I really appreciate that you are concerned about your health. So, Mrs. Seema, in order to confirm my diagnosis, I need to perform one blood test. Is it okay with you? Okay. Okay, I'll offer you follicular stimulating hormone level and test, and it is tested on 2 occasions. Okay, more than 1 month apart. Okay, and if it will more than 30 nanogram, then it will confirm that. As you stated, your mother had early menopause at the age of early menopause, so maybe it will confirm that you have hit the menopause. Okay. But before I order these labs, let me ask you first if you have gone through any investigation. Okay, so you have done these tests on 2 occasions, like 1 apart. Okay. Okay, more than 30 nanograms on both occasions. Okay, so Mrs. Seema, what I have gathered from your symptoms and your FSH report is that most probably you are having a condition which we call in a medical term as early menopause. Okay, so do you know anything about menopause? Yes, absolutely. Yes, Mrs. Sima. This condition occurs due to deficiency of female hormones called estrogen and progesterone. So the logical treatment would be replacing these hormones. Okay. From outside in the form of medicine. Okay, and this way of treatment is called hormone replacement therapy. Okay, but let me clear it that the hormone replacement therapy is not without side effects. Okay, these increases the chances of breast and uterine cancer, and and cannot be used for primary prevention of thin bones or for prevention of heart attack. Okay, as you are concerned about these things, so I should clear everything to you. Okay, so HRT is recommended until the average age of menopause, that is 51 years, but your age is 48 years only. Okay, so before resorting to HRT, I'll offer you some lifestyle changes and some simple medicine. Okay, and we hope they'll relieve your symptoms. Okay. Okay, so let's talk about non-pharmacological first. Okay, so I'll strongly encourage you to avoid stress. Okay, and try to do some exercises like yoga, deep breathing exercises, meditation. Okay, and try to remain cool and be in cool ambient temperature. Okay, and wear cotton loose clothes. Okay, and take plenty of water, and try to avoid food and drinks like spicy food, alcohol or caffeine. Is it okay with you? Okay, now and can we start pharmacological treatment? Okay, Mrs. Sima. So I'll offer you antidepressant medicine. Okay, and that is venlafaxine, 37.5 mg. You have to take it twice a day. Okay, it will help improve your mood besides hot flushes and sweating moderately. Is it okay with you? And I'll offer you a vaginal lubricant, that is a topical estrogen cream for local application, and this will help prevent vaginal dryness and recurrent episodes of uterine infections. Okay, as you stated that you under treatment for recurrent UTIs. Okay, is everything clear till now? Can I repeat for you again? Okay, Mrs. Sima. So, Ms. Sima, and let me inform you some safety nettings. Okay, if your symptoms is not improved, okay, then maybe I'll refer you to a gynecologist and psychologist for cognitive behavior therapy. Okay, and they may add some medicine as well. Okay, and I offer you a second follow-up visit after 1 month. Is it okay with you? It will be convenient. Okay, Mrs. Sima, is there anything else you would like to share with me today? Okay, Mrs. Sima, here is my contact. Okay, and you can contact me anytime. Okay, if you feel like SOB or something like that. Okay, and yeah, here is a leaflet. It includes all the information regarding your condition. Okay, and safety nettings and about lifestyle changes, everything. Okay, I hope it will be helpful for you, and thank you for your cooperation, Mrs. Sima. I wish you a speedy recovery and a healthy life ahead. Okay, take good care of yourself. Bye bye.